I'm Rich Downs, and I'm currently a Emeritus member of the Phoenixville Community Health Foundation. And I always like to, when I start talking about the history of the foundation, I like to start back in the 1950s, before the dinosaurs. That's when Dick Kunch had his tonsils out at the old Phoenixville Hospital, where the high school and Phoenixville Hospital shared a lot. Then this high school sold their property to the Phoenixville Hospital so that they could have the new hospital. And why I bring that up, I just want to make sure I get through that the Phoenixville community really focused on making sure we had quality health care in Phoenixville. And it has continued forever. So where did I come from? I came on the board in 1988. And at that time, the Phoenixville Hospital was well run, made $1 million, $2 million a year, all plowed back right into the hospital. And we really had a good operation. And we had a foundation, we had a for-profit called Chestmont, and we had our hospital. And all three were operating and with the same board, except for the foundation. It was run by Sam Jervis at the time. I look back in 1993, as a defining moment for me. I happened to be chairman of the Phoenixville Hospital at the time, and I was asked to meet with the University of Pennsylvania with Dick Seagrave. And the discussion went with, Penn wanted to have an affiliation with us. And I'm a Southwest Philly kid, so I thought Penn was the elite. And when we're meeting and they want to partner with us on different affiliations, but at the same time they made it clear, they don't want any bids. They just want affiliations. So we took it to the board, and the board said, yeah, let's do this. And for a year, we were sending our tough cases down to Penn. Penn was sending services out to Phoenixville community. So we just continued to move forward. And then 1994, Penn said they wanted to meet with the board again. And in 1994, Penn says, we do want some bids. We want to buy your, no, they never said buy. They want to acquire our hospital. And so they acquired, well, no, that's not true. In 1994, we put together a committee of John Sickler, Dick Kunch, and myself, and we went out and met with all the other local hospitals, both profit and not-for-profit, and we considered staying independent, but it was a struggle because of being a local hospital and reimbursements for Blue Cross Blue Shield, etc. And so we moved forward, and Penn also owned our major doctor group. And we decided Penn was the right partner for us. So then we went into negotiations for 2.5 years. It was sort of like a give and take war, with us wanting to keep control of our local hospital and healthcare in our community, and Penn saying, look, just turn all the assets over and trust us. Trust but verify is what I think Ronald Reagan said. So anyway, we put a bunch of requirements together and convinced Penn to accept them. One was, for 10 years, they had no right to sell the hospital, merge with another hospital, sell any assets without the foundation's approval. That was a big one when we talk about this later. At the same time, we also had insisted on a local board made up of two members of the foundation, and other local community members and Penn members. So we had a board on site at all time, and we kept our same CEO, Dick Seagrave. So they were the key things that we got in 1997. We actually merged on June 30th, 1997, after 2.5 years. Dick Kunch became the chairman of the Phoenixville Community Health Foundation, but it was just a transfer of assets from Phoenixville Hospital Foundation and assets from the hospital. We took $16 million from the hospital. We took $14 million from the foundation, so we started the foundation with $30 million. We left $16 million with Penn, and we also had an understanding in the event that we would approve any transfer, they would give us that $16 million back, plus any grants that we gave to the hospital. So for a year, we put together a structure with Dick Kunch as chairman of the foundation, me chairman of the hospital, and Jim Redding chairman of Chestmont. And so we had, I thought, local control. And again, the key is local control, make sure we have top quality healthcare in our community. So a year went by, we earned another $2 million. That brought us to $32 million. We weren't making any grants yet because we had no leader. And in 1998, we hired Lou Beccarera. After an extensive review of candidates, we came up with him, and he led our organization for 21 years, and he just did a wonderful job. And now the foundation was on a steady course of granting money into the community, starting with our $32 million. At the same time, our relationship with Penn seemed to struggle. They kept on thinking money should be going downtown because they were running into some financial difficulty. And we kept on thinking money should run to us. Capital improvement should come our way. And we should be pretty much on our own and improving the hospital health care. In 1999 was another major event, and it turned out to be a pretty good one because the doctors said, we want to go back to independence, because they didn't like the way Penn was treating the hospital. And so that gave our local board and our foundation some power to go back into negotiations with Penn, and we did. And again, 2.5 years, we worked on a memo of understanding. But whenever we got in the negotiations with Penn, it was a good thing because they sent people out and we could build a case because we were always the same people. Penn kept on changing leadership. And we had the tapes of all our meetings, we had the notes of all our meetings, and we were way ahead every time we went in negotiations. So the people coming out from Penn were always on our side. So it worked out. We got a memo of understanding. Money started to flow our way. We started doing a lot better. But then it still wasn't all roses because in 1994, Penn says, you know, we don't really want local hospitals anymore. So that's only 6 years, right? 6, 7 years, and we have a 10-year agreement. You can't do anything without our approval. So we went into negotiations again, and we put the same committee together. We met with all the for-profits, not-for-profits again to find out who had an interest in our hospital. And we had a lot of takers. And in 2004, after 2 years of negotiations, we ended up with merging with Community Health. As Penn was walking out the door, they had made $61 million worth of capital improvements. They had doubled or tripled the revenues. We were a much bigger, better hospital than we were as a single hospital. So Penn did a good job in the end, but it was a struggle. Community Health, we went into negotiations with them, and they guaranteed us $90 million worth of capital improvements. As it turned out, they really made $120 million worth of capital improvements. But they had their own, we again kept some leverage with community because we also asked for agreements for 10 years that we could keep an eye on things and they would report back to the foundation on a annual basis at least. And we had some board members, they also had a local board that kept in touch, and they hired a new CEO, and his name was Steve Tolman. And Steve just retired recently, and he was a wonderful steward for our Phoenixville community because he hung in there for 17, 18 years and really helped us. I want to drop back to the year 2000 when Penn and us were having an argument. They fired our CEO overnight without any advance warning from us. We went downtown, we protested like the devil, and they refused to rescind the dismissal of our CEO. And we were given a new CEO, and his name was Kevin Mahoney. And that turned out to be the best decision for Penn and Phoenixville because Kevin became a great ally for the Phoenixville community. He's currently CEO down at Penn Medicine now, and he's always been a wonderful ally for us and always stuck to the community benefit of Phoenixville Hospital. And although we fought the decision, it just changed the world for us because he had so much more influence down at Penn than our past CEO, Dick Seagrave, did. So that brings us to 2004. We have Lou Beccaria carrying on. We're now sort of on cruise control. And the other thing about community health was so good, was they were for profit. So not only couldn't we give them grants because they're for profit, they had to pay real estate taxes. So it was a windfall for the community, and it was a windfall for the foundation, because that was the other thing. At 2004, we got another $16 million, which we left with the hospital, plus we got $8 million back because of the grants we made in the past. So that gave us another $24 million, going with the 32, so that gave us the $56 million that we moved forward with. So now we're giving 5% of $56 million. And no real significant events. The operation of the foundation was just spectacular. We gave over $44 million worth of grants through 2022. We started healthcare access. We helped the clinic for impoverished people, and people are uninsured. We've supported PACs. We've supported the house. We've supported Mom's House. We've put $44 million back in the community. At the same time, we have $56 million in the foundation. And we got $160 and $180 million worth of capital improvements to the hospital and out on Route 422, the medical office building, as well as the surgery center. And that was the other thing. We finally sold Chestmont, I think, 2017, 2018. It became complicated. We got another $2 million, $2.5 million for that. So that gives us $58.5 million. But the good thing about Chestmont, what their for-profit was, they would buy all the local houses in the neighborhood, and they bought the land down on 422. So they were sort of our development side. And as soon as Penn took over in 1997, they moved in and took those assets except for the medical office building, which is what we just sold in 2008. And I guess, so we got so much better services. What did the foundation, how did the foundation change the community of Phoenixville? And if you think about it, not only do we maintain the hospital, get $180 million worth of improvements, we have a foundation with $58.5 million that we give 5% back to the community, and we still have the 58.5, and we put $44 million in the community on amazing things. And I keep on getting back to healthcare access and the clinic as the major ones. And I like to leave it with, Lou did a wonderful job for 21 years, and now we have Tamala, Jeanette, and Vivian, and I'm really looking forward to seeing their history and the differences they're going to make as we go forward. So I'm talking to you as a 75-year-old Emeritus member, don't have a vote anymore, but it was quite a history that we went through from 1988 for me till 2022. Thanks for your time. Well, they voted me in at the hospital, and then when the Penn and Phoenixville Hospital merged, they had to have some local members, and then Penn appointed me president, then chairman then too. So I was chairman from like 1994 to 2007. I was even stayed on Penn Medicine Board 3 years after the separation, so I could still tell them, because we still had affiliations with them going forward. That's the other thing with Tower. Now Tower wants all the stuff to go to Reading, and we want everything to go to Penn downtown. So that's why it's not going to be that successful I don't know what Reading was thinking. They're all Penn doctors. They're not going to send people to Reading. They're going to send people to Penn. It just hit me. But yeah, I was just voted in once. I was a finance guy, so they wanted somebody to be on finance, and after 2 years they said, you want to be chairman? And I said, okay.
Where were you finance guy?
For the foundation.
What was your?
I'm a CPA and an MBA, and I love accounting and finance. I'm a nutcase. I just love spreadsheets. You can see I put my summary on a spreadsheet. I just do I got lists, and that's the other thing. I just wish I could get in some way. I have a list of 44 legends, and even though I've been around for 12 plus 20, 36 years on the hospital, I mean, this is a list of the people I ran through that I always felt like a new kid on the block, the old people that really were before me, that were sort of my mentors and helped me through. And So, yeah, I just, I'm a record keeper. You can see I sort of have records of everything. I have file cabinets full of this crap. I just want to add one more thing. I was asked a question of, how did I become chairman of the hospital? And I moved into the community in 1976. And even then, today, I feel like a new kid on the block because there were so many people that helped the hospital back in the 80s and the 70s and were effectively legends to me when I came on board. And they were so helpful and supportive. And I have a list of all the people that I just think are so important. And I want to make sure these names are never forgotten because these were mentors to me. They really helped the Phoenixville community every way. We're all volunteers, so it was all volunteers throughout. And I just want to make sure their names aren't forgotten. Most of them have passed away, and that's the scary thing, that these people have gone, and I just don't want their names to be forgotten. So I'd like to leave that thought with you as well.